Thank you, Mr. Chairman, members of the committee. It's certainly an honor to be asked to testify before Congress, but particularly for me, this subcommittee, with my past work with Representative Murphy and with the committee, having had the opportunity to work with many of you and to come to understand the dedication that you and your staff bring to the important issues that this committee deals with, makes this a very humbling opportunity for me, and so I thank you very much for that. My written statement details some modeling that we've done on Affordable Care Act spending provisions that we could dial up or dial down in order to generate some savings. That modeling I'm happy to go into if people have questions. I think that those savings could be used to pay for other spending priorities, but I was hoping to take a step back and maybe talk a little more broadly today about the topic that we're here to discuss. When I arrived in D.C. 10 years ago as a congressional intern, we had a federal debt of about $7 trillion. As we all know, today the federal debt is now past $18 trillion. We can point fingers and try and lay blame, but the reality is that this is not entirely the fault of one party or the other. We've gotten here together. And I think you can see that if you look at the immediate last two presidencies. During the presidency of George W. Bush, we saw the national debt double, and under this presidency of Barack Obama, we're flirting with doing that again. So we can argue about whether or not we have a spending problem or a revenue problem, but I hope that we can agree that we have a debt problem. And while we all have, I'm sure, our pet peeves for what's driving that debt accumulation, the 800-pound gorilla in the federal budget is mandatory spending, which makes up 60% of the federal budget, and in particular mandatory spending on health programs, which is about 30% of all federal spending. And as this spending continues to grow, it's crowding out other discretionary spending, things like defense, but also things like funding the NIH. And so as we look at that, unfortunately, rather than addressing that looming entitlement crisis, President Obama chose to focus on passing the Affordable Care Act. In doing so, he expanded spending in the Medicaid program and put more people into that broken program. He also created an entirely new entitlement, these subsidies for the under 65 population available through the health insurance marketplace. And then all the while largely ignoring Medicare beyond the $700 billion in cuts that were used to pay for the other priorities, particularly cuts to Medicare Advantage and also to home health. As we look to the 114th Congress, I think we can recognize that the big policy agenda items that conservatives seek, repealing and replacing the Affordable Care Act, large-scale Medicare and Medicaid reform, are likely out of reach. But we can and should take the opportunities that present themselves to move towards those goals. And so in particular, as Congress looks at the entitlement spending, both new and old, that continues to grow, I would remind you that the Budget Control Act has largely left the ACA unscathed. And as such, I think it is appropriate that as Congress looks to fund other health priorities, particularly the SGR reform that's coming up, that we can look to the ACA as a mechanism by which those other priorities can be paid for. And then finally, briefly, I would say with an eye towards long-term fiscal priorities, I urge Congress to protect the Medicare Part D and the Medicare Advantage programs. These are excellent blueprints for how entitlements could be structured and should be structured, and they provide a roadmap for moving past the fee-for-service Medicare system today. With that, I'm happy to take your questions.
Sure, thanks, Sheldon.